who will be introducing our Whitecoat recipients. So, Brian, so Michael, what I might just have you do, because you've got the motherboard, is maybe, you know, sit in one of these reserved seats up front or in the back row of this reserved section.
Or walk in at the beginning back there.
To just kind of mic check, you know,
Yeah.
because if Bob is limited to what and has it turned all the way up in the closet.
It looks good though now.
Okay.
In fact, it's picking me up from over here, right? Yeah.
Okay.
That's really good. I think we got it solved.
Just keep that with you.
Of course.
Murphy says then we won't.
My voice is even louder, so, and if it can sit farther back, I think everybody's more comfortable that way.
Yes.
Yeah.
Nobody wants it right here.
No. That's good.
Nobody likes to eat the microphone.
Yeah. Ladies and gentlemen, welcome to the Whitecoat ceremony. No, that's good. Perfect. I think we're good.
Thank you.
And then, okay, go to L1.
Or Brian, are you going to go to L1?
You want to jump into L1 and I'll just
Okay.
babble along here.
I'm going to stay.
How's your puppy? What's going on with the dog?
She's good.
Is
She
there-
had a little marrow. I gave her a marrow bone,
Yeah.
frozen marrow bones from the butcher at Cub, and
Right?
evidently it's a little too rich for a 12-and-a-half-year-old
Oh,
dog
yeah,
to
yeah.
go after the
So
whole
she's,
thing.
so she's,
So she had a little bout of diarrhea.
Oh, no.
And then throwing up, and then it became
Well,
bloody
isn't that a lot of
diarrhea
fun?
Because like the bacteria is all out
Yep.
of whack, and she can't write
test
it.
1, 2, 3,
herself?
test 1, 2, 3. Keep it testing, see if he's coming back. What's the young man's name again?
So,
Right?
well, you know, it's the one that's probably like
It's not very fun.
this long, and so.
How are we doing over there?
I don't give her rawhide.
Too loud,
anymore
not too
because
loud?
They come from China, and
Right?
she had one of those before. My sisters gave her like a huge one at Christmas.
They come from China?
Yeah, and like it was.
L1 can barely hear it?
Did you turn the volume up on the projector? It's all the way up? Okay.
Oh, that's a problem.
Okay.
All right. Well, problem solving each one of these rooms. Yeah.
So
Let's make
so yeah,
sure we
so
get it.
Wednesday, it's like Tuesday. She had.
Dr. Kalb, how are you?
So yeah, so she's fine. She's on medicine now, and
Yeah.
she's good. And then I brought her to the vet, which is the same place my neighbor takes their dog, and Rosie had a torn ACL,
Oh, lovely.
and she's 8.
You have 2 dogs?
No, my,
Oh,
oh
okay.
God, no. One is playing.
Yeah.
But I'm not a fan of the retractable leash.
We'll just turn this thing on and you can hear us talk about dogs,
Let's just talk about puppies.
puppy dogs.
So,
yeah.
but yeah, so she's doing fine now, though. She's on drugs, and Rosie is, was trotting along on 3 legs, like it was totally fine. The hard thing is, it's back leg, and so she's a squatter
Yeah, of course.
when she pees, so she's got to figure that part of it out. But it's amazing to me how quickly they recover,
Oh, I know.
and
It is amazing.
so-
But if they're 8, maybe not when they're 16.
right,
Yeah.
exactly.
I think that's biggest concern is if we put her under, does she come out of the anesthesia okay?
Exactly. It's the same thing, like
Yeah.
when my grandma,
Oh,
at
yeah.
96
Us too,
fell
right?
and broke her hip and
Absolutely.
had to have surgery, and I was just like, okay, this is the end. She's not going to be able to survive that. But she came through it great. She went through some crazy, because of all the anesthesia and whatever in her system. And I remember going to the hospital to see her, and she's like, none of this is mine. Like the whiteboard that they write on the TV.
What's that? I don't think so, right?
didn't
Did you think it
I
got
didn't
really
notice
loud?
It is louder in there.
Okay, perfect.
ladies and gentlemen. The program will be starting in 5 minutes.
Ladies and gentlemen, please rise for the procession of the Whitecoat recipients from the College of Chiropractic at Northwestern Health Sciences University. Please remain standing for the national anthem. Please be seated. Well, hello, everyone. I'll do that again. Hello, everyone. Well, on behalf of the T6 class and all of us associated with Northwestern Health Sciences University, I extend our warmest welcome to everyone attending our College of Chiropractic Whitecoat ceremony. I especially want to welcome our most honored guests, the families and friends of the recipients. I know I speak for our students when I say your support and presence here today means so very much. So before I begin, I would like to introduce some of our Northwestern's administration and faculty that are with us today on the platform. Dr. Deb Bushray, President and CEO of Northwestern Health Sciences University. Dr. Ray Hendrickson, the College of Chiropractic's Alumni Association and Vice President. I would like to recognize the Alumni Association for their generous gift of the white coats that the recipients will be receiving today, so thank you, Ray, for that. Dr. Kristy Weber is the assistant professor and our keynote speaker today. She has an incredible, yes, we're very excited. Dr. Anita Manning, she's a professor and presenter of the recipients. Dr. Tolu Oyello, associate professor, director of clinical services, assisting with coding. I think I may have gotten your title wrong. I've added a job to you, maybe. I think I did, yes. Dr. Zach Zachman, professor and clinician, also assisting with coding. I also want to take a moment and recognize our CBI doctors. Are there any CBI doctors with us this afternoon? So our CBI doctors open their doors to our interns, providing expert instruction and mentorship while our students move through this important phase in their training. So we want to thank those CBI doctors for their incredible generosity in sharing their expertise with our interns. So we certainly want to thank them. Yeah. So my name is Dr. Trevor Foshing, and I'm the Dean of the Chiropractic Program here at Northwestern Health Sciences University, and I want to, again, thank you for being here. And hooting and hollering for your intern is perfectly okay. So maybe we want to try that, really, just practice it once. Maybe, just a yay, let's try that. Yeah. That was okay. It was actually pretty good. You're right. It was pretty good. Let's do it one more time. Yes. That is fantastic. Well, again, I wish you all a very good evening. I typically open up this ceremony by letting the students know that the white coat ceremony is, in fact, my favorite event on campus. And I'm happy to report that it remains my favorite event, even more so than graduation. But you might ask, how could it possibly be better than graduation? Well, for me, I sense that there's just simply a different energy amongst our students at the white coat ceremony. Maybe it's because they're not quite exhausted yet. They're close. Or maybe it's because they know that there is still much left to do. In fact, in many ways, these brilliant interns are just getting started. At this point in their academic journey, they have successfully moved past much of their foundational training in the basic sciences and in the clinical sciences, and are excited to enter the clinical setting. And of course, in the clinical setting is where the white coat is worn. So let's briefly talk about the white coat for a moment. The white coat was originally developed to be worn in scientific laboratories, basically to keep scientists' clothes clean. It was adopted as a standard of dress by doctors, clinicians, if you will, in the late 19th century as physicians sought to incorporate scientific principles developed in the laboratory setting into their clinical practices, symbolizing really an evidence-informed perspective. So the donning of the white coat is now a century-old tradition and a symbol of the responsibilities of a doctor, which are, as we know, to acquire a tremendous amount of knowledge and skill and apply this knowledge and proven principles with purpose to treat patients and provide guidance to them as they wish to heal and live a healthier life. So beyond the very cool Miami Vice, Sonny Crockett look of the white coat, anybody get that? Okay, good, thank you. The white coat has several practical functions: ease of recognition that you are, in fact, a healthcare provider, and the pockets, of course, for carrying tools, items like reflex hammers and pinwheels. In fact, interns, your white coats will serve as a repository for information, so that when you are in the treating room and your memory fails you, you can simply look into a pocket. They will soon be filled with reference cards and patient information, maybe a folded journal article or two. And as mentioned, you'll have a pen light, a tuning fork, a stethoscope. Well, as a result, your white coats will become heavy for several reasons. So today, as Dr. Ojello and Dr. Zachman place the white coat on your shoulders, and every time from this point forward, let its weight be a reminder of all of the work you've put in and all of the knowledge you've acquired over the last 2 years. While they place this white coat on your shoulders, recognize the weight of responsibility that you are now symbolically wearing. Recognize your responsibilities as an intern, preparing to take on the role of knowledgeable doctor. So trust me when I say your patients expect the very best from you. So remember what your faculty have taught you and apply what you have learned responsibly. In fact, faculty, if you would, please stand. And students, please join me in thanking these exceptional people dedicated to your training. Thank you, faculty. One of these exceptional faculty members that we are lucky to have with us today is our keynote speaker, Dr. Kristy Weber. Well, maybe I should just tell you a little bit about her. She's got a unique background. She is a graduate of the University of Minnesota with a bachelor's degree of science in mortuary science, graduated in 1998, and subsequently worked as a funeral director and later as a deputy coroner for both the Anoka and Dakota County Medical Examiner's Office. She returned to school and in 2010 graduated from Northwestern Health Sciences University with a bachelor's in human biology and a doctorate in chiropractic. After graduating, she opened her own practice in the northeast Minnesota or Minneapolis area, and we lured Kristy back to Northwestern in 2015 when she became one of our associate, or rather adjunct professors in the DeRusha Clinic. And then following the following winter, she became a full-time assistant professor, and since then has been working in the clinical internship program and the methods courses. Kristy, are you ready? Yeah. I am very proud and honored to introduce Dr. Kristy Weber.
Okay, so T6 interns, I have one question. 0 to 10, what do you give it? Yes, you do. So I have had the honor and privilege of currently teaching these students in Clinical Internship 1, where we're preparing them to move into clinic next trimester when they are T7s and be working and starting to treat patients with us downstairs in DeRusha Clinic. And prior to this term, I had them for Methods 5, where they practice their adjusting techniques and skills. So I know that today, as they get the coats, and this is kind of a milestone as they move towards clinic, that they look forward to being able to get their hands on patients and help people move away from pain, and are very excited to do all the fun things we get to do in chiropractic. Get people back to the activities they haven't been able to do because of restrictions, be able to cultivate important relationships with patients based on trust and mutual respect. I also know that they know that this is a hard job, and I know that they know that because I've been telling them since Methods 5. So I know that they know that this job is a lot more like community service, because this job is about the patient and not about you. That they know that they have to do this job even when they're tired, even when they're frustrated, and even when they don't feel like it. That they have to listen to the patient, act on the patient's behalf, treat the patient to the best of their ability, work within the scope of their license that is afforded to them by the state or the country that they're practicing in, and still be good stewards of chiropractic for their patients and in the communities that they serve, even when they're tired, even when they're frustrated, and even when they don't feel like it. So I first got to be the teacher of these wonderful students last trimester in their T5 methods class. It also happened to be the first time I ever taught T5 methods. So there were 121 students, no pressure, it's fine. It was also our winter trimester, which has its own special, fun nuances that go with it. So we have our Chiropractic Homecoming, which happens at the beginning of February, where we have 2 days where our chiropractic alumni come back to the school and do their continuing education. So we have a lot of activities at the school and lectures and things going on, but what we don't have are classes and labs. Then we have 2 holidays, Martin Luther King and President's Day, where of course the school is closed, so we don't have classes and labs. Then we were kind of in this debate about, are we going to not have a midterms week, have a midterms week? And then we had a midterms week where what we do is we have all tests, but what we don't have are classes and labs. So, needless to say, we had a lot of rescheduling and fun, exciting things to do around that. And then, in case that wasn't enough excitement for us, Mother Nature decided to step in and help out a little bit too, and we had 17 snow days. No, we didn't have 17, it was like 3.5, but it felt like 17. So we had to do a lot of rescheduling, communicating, changing things up. In any given week, every lab was doing something different, and that might not even match the lecture, but they were great. They were kind, they were generous, and they were patient with me because they knew it was the first time I had done it. Even when I had technological difficulties, why doesn't this clicker work? How come these slides aren't changing? What's wrong with this clicker? And then someone would say, did you turn it on? Oh, you have to turn it on? Why is it not already on? How does, all the way from the little tiny things like that to their last day of scheduled classes in T5, which was with me for their Methods 5 written final and then their practical final, which again, of course, Mother Nature threw a wrench into that, and we were going to have a snowstorm. So we had 121 students to get through their final practical, and we had people who were traveling by plane and automobile that we had to get through the test. And again, they were patient, and they were kind, and they were generous to me. So one of the things I know is that they're prepared to move forward because they helped me as a class, as individual groups, and as individuals themselves, anytime I needed it, anytime I asked for it, even when they were tired, even when they were frustrated, and even when they didn't feel like it. Now you might be saying, well, Dr. Monham, that's a nice story, but how do you know they weren't just raised right? And fair point. But you don't get to sit where they're sitting right now with those coats if you didn't do the work. And it is a lot of work. The grind of it is crushing. It is a lot of things to sacrifice and give up, as you know, because they've probably had to give up things that you wanted them to be at, to be able to be here doing the work it takes to sit there right now. If they've lost clumps of hair due to anxiety, they've put on 15 pounds from stress eating, they've had soft, gentle weeping in the shower just trying to make it through the day, and that's how it goes, because it is a lot of work. So I was trying to think, how do you show the representation of work? And, they all have their iPads and their tablets, and you see them working on there, and they're supposed to be doing their homework, but then you wonder, are they really watching Netflix? I'm not sure what's happening. So I was, if you're like me and you're older, you need a more tactile visual to be able to see, what's the work like. So I called our amazing library staff here at the school, and they did me a small favor, so give me 1 second here. I'll put this out for you. Go ahead. Do you need any help? So this is not a full representation, but these are most of their required texts, most of their classroom notes that they have had to study and learn and reproduce from T1 through T6. So it's not everything, and I want to be clear and transparent. It does not show the assignments, the quizzes, the tests, the lab practicals, studying for boards. It does not show the blood, sweat, and tears that went into doing all the work. And I do mean the literal blood, sweat, and tears. I mean the tears they cried when they finally passed Dr. Swinehart's anatomy class. I mean the sweat they burst into every single time they had to take a Dr. T exam. And I mean the literal blood that they had to take from each other more than once for Dr. Bowers in ClinPath. So it doesn't show everything, but it gives you an idea of the kind of work it takes. So for my T6 interns, what I want you to know is that you deserve to be here because even when you were so tired you didn't know which way was up, even when you were so frustrated you didn't know what to do, and even when you really felt like you wanted to quit and that maybe you should and you didn't, that's why you deserve to be here. You earned it. It belongs to you. Enjoy this moment. I'm so very proud of all of you. Congratulations.
I now present Dr. Anita Manning, who will be introducing our white coat recipients.
Thank you, Dr. Faucheng. Well, distinguished guests, families, and friends, on behalf of the faculty of Northwestern Health Sciences University College of Chiropractic, it is my honor and distinct pleasure to present the recipients of the white coats. I ask our new interns to come forward as I call your name, and I notice there's no sessile or pedunculated among you. Dr. Talu Ayelowo and Dr. Zach Zachman will assist with the presentation of white coats for the recipients, and people, family, friends, as I call their names, you rush up here and you take pictures or whatever you have to do. That's your job here, all right? So the first row, yes, I think that's right. All right, we'll wait till everybody's in line here. All right. Danielle Abitz. Alec Adamski. A good fit. Kyle Ahrens. Brandon Allen. David Anderson. Sydney Arnold. Robin Brar. Serena Brar. Michelle Brecker. Dylan Brendy. Ryan Colton. Chase Crabtree. Bethany Crossweight. Sumit Dalla. Brittany Doucette. Mark Dvorak. Josh Ermentrout. Lucas Emmerich. Kayla Faschingbauer. Gretchen Phelan. Paige Ferrazzo. Allie Field. Sarah Gamoki. Zach Gowerke. Braylee Giggleman. J.C. George. Dominique Geeson. Mackenzie Grinna. Ellen Halley. Sean Halliday. Noah Hansen. Nicolette Harris. Rachel Hessler. Cody Haugen. Joshua Harrington.
Hoffman. Luke Holt. Seth Huber. Jared Emoto. Kevin Jean. Ashley Johnson. Samantha Jorgensen. Joe Kara. Kinsey Cook. Patrick Conda. Aaron Kubal. Cody Larson. Lauchi Lee. Emery Lip. Colton McLean. Caitlin McVeigh Jungles. Peter Mering. Dalton McCollum. William McMullen. Brooke McCulloch. Dylan Morgan. Nicole Monroe. Amy Munsterman. Rachel Nelson. Carly Nye. Sammy Nielsen.
Elise Nolte. Mitchell Olson. Emily Payne. Nick Perrott. Emily Poland. Andrew Poquette. Kendra Prawl. Ross Rath. Kilby Reck. Wendy Reich. Kayleen Ryder. Abigail Remus. Aspen Rhodes. Taylor Rick. Megan Rogers. Kendra Rolson. Danielle Ross. Catherine Salazar. Brianna Samoleski. Amy Shelper. Bria Schemenauer. Peyton Schaefer. Natalie Schumacher. Samuel Schwieters. Emily Spear. Joey Sterner. Rachel Stevenson. Lauren Stoiber. Sarah Take. Did I say it right? Munisha Tataneni. Tanner Topin. Andrea Toppin. Tanner Triggested. Tyler Uckelberg. Chelsea Vasquez. Jordan Verfeli Kobayashi. Caleb Vig. Zachary Walker. Catherine Walskog. Matthew Weber. Brant Weldon. Cody Wolf. Chia Yang. Tara Zeinstra. Kara Zemer. And William Zimmer. I don't do anything else, do I? Okay.
That was a lot. Samantha Nelson, class representative and student senate secretary, will now administer the class's oath of professionalism. Sam, would you join me at the podium?
On this day, June 28, 2019, in the presence of family, friends, esteemed faculty, and staff, I hereby affirm to hold myself and my colleagues accountable to the content and spirit of this oath. Please join me for the rest of the oath. With honor and pride, I vow to uphold the rights and responsibilities entrusted to me by my training as a doctor of chiropractic at Northwestern Health Sciences University, and commit to become an active steward of our chiropractic profession. I will faithfully serve the well-being of my patients by upholding myself and my colleagues to the highest degree of professionalism and integrity with unquestionable and unwavering ethics. I will advocate for my profession as a distinct and holistic approach to health. I will esteem those who have taught me the art, science, and philosophy of chiropractic, respecting the knowledge, wisdom, and contributions of my predecessors. I will at all times stand ready to serve my fellow man and profession by exemplifying in my own life a pattern of living in harmony with the laws of nature. I will act within my capabilities and recognize my limitations. I will act in my patient's best interests and will regard the keeping of his or her confidence in me as a moral obligation. I pledge my dedication to this practice of chiropractic so that all those I serve may discover true healing, transformation, and awareness in all aspects of their lives and consciousness through chiropractic. May God so direct the skillful use of my hands that I may bring strength to the sick, relief to the suffering, peace of mind to the anxious. May I provide inspiration to mankind to attain bountiful health and live this life to the fullest expression of its innate endowments. With great reverence, I will always affirm these principles, acknowledging that every human life is valuable and powerful. I uphold myself to this oath of my own volition. I do this freely and righteously in commitment to learning, living, and serving healthy. May I hold fast to the enthusiasm, passion, and idealism with which I take this pledge. Thank you.
I'd like to call upon Dr. Hendrickson. He'd like to say a few words of welcome.
Well, that's a tough act to follow. Thank you very much. Again, on behalf of the Alumni Chiropractic Association, congratulations to each and every one of you. You're about to embark on what you really came to chiropractic school for. You got through your basic sciences, and now you actually get to start practicing with interns, and I just can't express how much fun it is going to be for you getting out there. And I just turned 66 a while ago. I've got a retirement practice, and it's just as fun when I first got out in practice as it is now. You're just going to be amazed at the relationships you will build. The people that come into you every day, every one of them, they trust you, they know you can, they think they can get, you can get them better, and it's just an awesome, humbling responsibility to see every patient that comes in your office. So I just wish you the best on that. And I don't know, how many of you knew of a Dr. DeRusha? Raise your hand if you heard of that name before. Dr. DeRusha? He was one of my elderly instructors when I started chiropractic school back in 1980. I graduated in 1984. And he had a lot of neat sayings, but one of his sayings, he says, "You will take a back seat to no one." And you think about that, you've got something special, really, really special you're learning here. The chiropractic profession, I mean, you're going to be healing people with your hands. No one else can do that. They can go to the medical doctor, get some pill to get rid of an inflammation or cover up other signs, but you're going to actually get their body better so it can operate. And it really is a humbling experience. And just the last 2 weeks now, it's interesting, the people you see. I just have a referral-only practice. One of my patients brought their 2-year-old newborn son into the office to get checked out. And yesterday, I seen a 91-year-old gentleman that came in the office that's still actually playing golf. So you look at that span of people you can see from birth to 91 years old. It is a very humbling experience. So I just wanted to mention one other thing. When I travel, I really enjoy stopping at a chiropractor's offices. Most people I don't know, I'll just stop in and introduce myself and ask them if they'd like an adjustment. Because if you're a lone practitioner out in a small town in South Dakota, North Dakota, Montana, or wherever, they really could use an adjustment. And so hopefully I'll be visiting your office someday. And, but you know, it's amazing. It's quite a community. I've never been turned down, you know, saying, "Oh, I'm too busy for this, too busy for that." They welcome you into the office, and it's a great community. And I am just so thankful for chiropractic. I'm thankful for the instructors that I had when I was going to school. I'm thankful for these instructors here teaching you chiropractic skills. I'm very thankful for our school. I'm thankful for the new leadership we have, Dr. Bushway, and with that in mind, I'm going to turn it over to her. So, Dr. Bushway.
So how you feeling? Really? A little better? Oh, you're hot. Okay. Well, okay, I'll try again. Are you feeling good about these white coats, or? Awesome. Well, so what I was thinking about tonight, right, and this is always such an important moment, such a pivot point in your education, and we're so incredibly proud of you. And I just want to take one moment and brag about how these students are and how all our students are here in the chiropractic program in specific. So there are about 17 chiropractic schools in the country, and our students continuously score among the top 3 schools on the board exams. So remarkable work, right? We are so, so proud of you. But so when I was thinking about tonight, I was thinking about healing, right? And I came up on a quote about that I want to share with you. So the quote is, "When we're mindful of the various elements of the human experience and are acutely aware of the sacred responsibility we hold when we treat another person, then we're humbled by the beauty, the sensitivity, and the complexity of the human design, the design of the human body and spirit. It is in that moment that we do our best work and are in service to the well-being of the patient, and we are grateful for the fulfilling experience of restoring health to that person." So what I wish for you are many moments of those fulfilling experiences of restoring health to people. You have a challenging road ahead of you, but I know you're well equipped, and I know you bring with you your best selves to do it. My sincere congratulations to each and every one of you for this point, for reaching this point, and for continuing on in this journey. I'm also fully aware that each of you, none of us reaches any point like this without incredible support from a community around you of various kinds, friends, family, loved ones, peers, who surround us with love, support, and maybe annoyance from time to time, right? But, so I want to ask you to join me in congratulating also your family and friends who've joined you here to celebrate tonight. So thank you to all of you. I hope each of you feels as proud as we do of this moment. So this actually concludes our ceremony. So I'd ask that the audience members rise but remain in your places while our new Whitecoat folks exit the auditorium and then join us in the cafeteria for some reception. All right? Thank you.